maybe people also want sometimes to dramatize it, that, like actually now if you would make a movie, it would be dead boring. People just staying home and doing random stuff, having fights with their family members maybe, and going for a walk on their own once a day. That's a boring movie. But then you need to go to like hospitals and show how everyone's dying and so on. I think apart from epicenters like New York and so on, everywhere else it was like actually quite normal. Like if you don't have this massive number of people dying in one place, all the other places were quite okay. And then, you can go actually every day to a hospital and film people dying. That's happening every day. I think, again, that's something that we take for granted, that no one's dying just because we don't see it. While for medics, it's kind of, you get used to that as you progress as medic. And people are. And this is, why it said quit smoking and so on, because, you see how someone like, you get the anesthesiology, you have operation done, and sometimes you do not wake up just because you were smoking, and it was so massively disrupted the whole recovery process that you just do not wake up. And people don't want to hear that. So the problem is just, I think that we are not aware how dangerous the life is in general, about how prevalent and around us are all other diseases, from heart attacks to coronavirus deaths, that people think that, okay, no one was dying before and now we have these numbers dying.
Hello and welcome. This is Ruta Naujokaite and you're listening to Lithuanian Dream Podcast, a podcast exploring ideas about contemporary Lithuania, a relatively small country in Northern Europe that regained its independence 30 years ago. Today we will be speaking with one of the most promising scientists from Lithuania, Ingrida Olendraite. She is currently working on her PhD at the University of Cambridge, and she is studying viruses there. This interview takes place during an exceptional time in our history when many countries around the world are under lockdown. Coronavirus completely changed the way we live, work, and communicate with each other. And here, where I am in Berlin, we're already way over 2 months of working from home. We will unlock some of the myths around coronavirus, engage in a conversation about the effect of coronavirus on our mental health. So you're writing your PhD in very interesting field, namely it's Computational Molecular Virology. So could you tell us more what it is?
Officially on the documents, it's going to be PhD in pathology. So it usually is that it sounds like completely different from what it is. But actually what we do basically, we use computers and different programming codes to search for many new viruses in data sets that people generated before. So then we find those viruses and then we characterize them. We see through this the sequences how they replicate, how they make their proteins, in which animals we can find them, what is evolutionary similar to other known viruses and so on. So therefore, we try to find new viruses and describe them molecularly to understand their molecular biology, and do that using computational methods.
Wow. So actually, it's really good time for you to study this topic because it's such an interesting time to live in. For sure, I think for me and for you, it's the first time we need to spend so much time at home. So how does it feel for you to see it in practice, how the virus can disrupt whole world?
I think for scientists in general, probably it was no surprise. We also are trained and we know how to work in environment of human pathogens and so on. So again, it's nothing new. I think all the scientists who are working on zoonotic viruses who jump from other animals and so on, again, nothing unexpected. So in a way, I think it's a good time for me, for my future funding. Maybe there will be more, because usually if it is not a direct threat, it's not that high on priorities. Well, now we have a massive, big example how we actually should know about all the viruses out there, at least in mammals, and be ready for next virus jump, which might disrupt our everyday life.
So, what were the viruses previous to this? I heard that there was a Spanish flu way before, like at the start of last century, in 20th century. And what other viruses were there that might have disrupted life in the world, but we forgot about it?
So the thing is that all these viruses who jump from different animals, jumping from one animal to another one happens quite frequently. But to happen such situation where it jumps, it can replicate and then transmit from human to human is another step, which not viruses succeed to do very well. So the SARS in 2003 and MERS, we had this case, but viruses were, due to many different factors, they were not that well transmitted from person to person. So therefore, it didn't disrupt our lives that much. Meanwhile, the pandemic influenzas, not only the Spanish flu one, but even in 2009, our known swine flu, it is there. It is still circulating, and we might get it any other day. So I think this is why actually flu-related research is really a hot topic, because basically any day there could be a pandemic from different strains of flu.
So what's the difference between other viruses and flu? Why do we call it swine flu and, like Spanish flu and other things we call like SARS? So what's the difference between these?
So naming in general is an interesting topic. So there is International Committee for Virus Taxonomy, and they approve names. So usually for virus, you can have species, and there is species name. And then there are all those unofficial virus names. So it's more like, I don't know, you have your siblings, you call them siblings, they share maybe the same surname, but you have a nickname for them. So therefore, sometimes we attach some different names to them. But the flu, swine flu, it just means that it came through swines, pigs to humans. This is Spanish flu had nothing to do with Spain. I think it was just that the journalists were the first ones to describe it and put it out there that there is a problem. So names come and go usually by what people maybe notice the most, what is easy to use. Though like on taxonomical level, it's way much more organized and clear. And usually when you name a virus, for example, SARS is quite good because it's severe acute respiratory syndrome. So it just describes how it affects other humans or animals. In this case, this is human. Bats are completely fine with that virus. Meanwhile, some other viruses have something to do with like animals that they are found in, their Latin name and so on. But usually it is very much asked not to put any name that would make the name political or if it would stigmatize a specific group. If I would be patient zero, for example, and get the virus from, let's say, swine, you shouldn't call it Ingrida Olendraite virus, because then it would stigmatize all my family and all Ingridas in the world. So there are specific rules, but the names that are floating around in the population, I don't know, that's just whatever hits the headlines.
Why do we call coronavirus or COVID-19? Is there a difference? Like, is one scientific name, another one is more like simple name, or what would be the explanation?
With this coronavirus, there is a problem that virus name is SARS-CoV-2, meaning severe respiratory syndrome virus. Coronavirus 2, because we had first more than 10 years ago. Virus name is this. We call coronavirus a big group of virus. It's like family, which would have, let's say, 10 different kids. And this is quite easy word to use. It's nice to show that it has that corona as sun has around it. So people pick that up easily and they can remember that. COVID-19 is the name of disease. So It's the same as we have HIV virus and we have AIDS, and sometimes develops into the disease, sometimes not. So it's the same here. Once you have the symptoms, you have symptoms of disease, not the virus. And therefore, so it's sometimes, funny how people say that COVID-19 is transmitting. Actually, virus is transmitting, and it sometimes causes the disease. But because COVID-19 is easy, it just rolls through out of your tongue. And SARS-CoV-2 is a bit harder to say. People just keep using COVID-19.
Yeah, and I guess you already got a lot of questions from your friends and even people you don't know, because you study such a, important science now in this point of time in history. So how is it for you as a scientist to see it happening in practice and see different responses from the governments? You are now in UK, right?
Yes.
Yeah, so you have example in UK, and you yourself you are from Lithuania as well. So you can compare already 2 case studies practically. So what do you think, how would you say governments are doing?
I think for every country it's very specific. Every culture has its own means. Like if it is something strongly recommended in one country, everyone's going to follow that. If in another country is strongly recommended but not enforced by law, no one's going to do that. So it really depends on the context. It also depends on health system. I think in Lithuania, a lot of our people, they are very much prone to complain about our health system, which is actually in a way perfect. It's not overcrowded. We have a lot of medics prepared. Actually, I think one fact that is frequently overseen is that we probably are the only one country in maybe world or Europe that, so basically we have the whole hospital dedicated to COVID patients. Because just recently, like a few months ago, before all the pandemic started, we opened our infectious disease new building. And in a few months' time, it's supposed to transfer people from old infectious disease hospital to the new one. And because coronavirus started, they kept those patients in the old building, and all the new building is dedicated purely just to COVID patients. So I think no one is probably having such a good situation as it is in Vilnius, not in every coast city back at home. Meanwhile, in UK, I think if people would have been following how NHS is always crowded, like even in some flu season time, or when there's a little bit of slippery roads, when you have more accidents happening, people were dying while queuing in emergency rooms. So, and plus Brexit happening, and there are so much staff, not stuff, sorry. And there are so many people working from different countries in NHS, and which possibly now left due to Brexit, that NHS was in really struggling position even before. Plus, UK has such a dense population. It doesn't matter where you're going to go, there's going to be people living there, which is not the case back home. So I think being a politician in these days is really hard. If you can manage, I'm actually not super opposing, for example, Sweden's situation. If we are doing quarantine to flatten the curve, not to overwhelm health system, Sweden did that. They don't have people dying because they cannot get into hospitals. So it depends what we want to do. If we want to save as many lives as possible, then Sweden's case probably is not the best. So it really depends how you manage to handle the situation. In a way, easiest way is to put everyone in a very strong quarantine, which I think happened back at home in Lithuania. And then, of course, it's perfect to stop the virus, but it's maybe not the smartest way to do that. But then if you cannot come up with any robust plan that is going to work, maybe it's quite a good plan to do that, rather than going there, I don't know if people are going to follow, not follow. It's just okay, let's put this strict, forbid everything. So virus-wise, it's good, but then again, we come to social problems, economic problems, and so on. And therefore, leaving the quarantine is a hard, again, decision, because you have to do it smartly. You have to have monitoring systems in place and so on. But I think the numbers that we have now at home, it should be quite fine. We'll see how it goes. But then, for example, one thing that I think the whole Europe, maybe not the whole Europe, but some countries could do a bit better. There are many guidelines how to act when there is pandemic, not pandemic. And for example, closing the borders, the countries which have similar numbers of virus is useless. The one person who comes through, like with a plane to Lithuania, can cause like an outbreak. The same person who lives in Lithuania and has a virus can cause an outbreak in some place. So basically, closing the borders is only effective when there are, like, let's say, 2 hotspots in the world. So then you need to shut down all the airports from that place rather than everything else. So I think that is a very big inconvenience for people, and it doesn't have that effect that people expect.
It's interesting that you're mentioning it, because the response from the governments was to close the borders. And, what do you think is the role now of EU for the countries within the EU? Is there any kind of a joint response countries could do together? Or now is the time just to go and solve it within the, your borders and then wait it out?
I think coming together is the best thing always. And even, for example, in a situation like this, where Spain is still having problems, Italy is still having problems, UK has problems. UK is not EU now, but for example, in Lithuania, the situation is now actually quite great. So then helping each other is something that we can do. And there is no point in competing in this thing, because if virus is somewhere, it can come to your country any day. So every country's problem with virus is everyone else's problem with virus. And you can even forbid all the leisure flights and so on, but there will be that one business person who's going to come and start an outbreak. And there were such cases even at the very beginning of the pandemic. So I think coming together is great. And yesterday, I think there was some kind of fundraising where people donated, or like countries pledged to vaccine development and so on. So I think now maybe initially everyone's like, okay, everyone's for themselves. Let's get all the masks and so on. But I think now, since the situation is a bit under control, countries are coming together.
So the countries are doing better now, step by step. Hopefully, there will be more cooperation for sure. And I heard in Oxford as well, you are based in Cambridge, but in Oxford, they're developing this vaccine. So when do you think it's going to be ready? Did you hear anything about that?
Yeah, I think the problem with vaccine development, especially in a situation like this, is that what takes the longest is to see in the long term how they're going to affect you. So even though maybe molecularly it's not that difficult to construct it, but then you need a lot of time to see if it actually works and if it lasts long enough to be worth producing. So we can't do that in any shorter amount of time. Therefore, I think some, let's say, experimental vaccines going to be given to people who are in a very, very high risk. So maybe, nurses and hospital workers, they're going to get it first. But still, even to that point, they need to go through many steps, right? And people in Oxford, they were quite optimistic that they can start doing that in autumn. But again, it until the point that we get the vaccine, so they need to go through all the testing, then maybe testing on bigger groups who definitely deadly need that vaccine. Then you're going to mass produce it, which takes time. Then you need to, have agreements. So I think now it's very important time for countries to start making arrangements, like in which position in the line they are to get the vaccine, because everyone in the world will need this. And then at some point, I don't know, after a year or something, best case scenario, we can get it. Yeah.
And what do you think about the testing? I live in Berlin, in Germany, and they just introduced the testing in private clinics, and it costs 60 euros. It's drive-in clinic. And then actually, it can detect the disease if you were infected 1 week or more before. So what do you think about the testing? Does it work? Or would you say at this point of time, people shouldn't just go and check themselves in case they feel like it, but they are not very ill?
Overall, I would say there's no point in doing that unless just like psychological, maybe in a way lying to yourself. But maybe, if you are going into panic mode, maybe it's okay to go and get some random test result. What kind of testing are they doing? Do you know? Are they taking the swab or?
Yeah,
Okay.
the swab, I think.
Because the ones which are from fingers, the blood tests, the immunity, like where do you even start with that? So basically, all the tests that were checked by many different countries, they are so bad that they show more results are not right than the right ones. So in a way, then if you are interested into buying such tests, it's just better flip a coin and see what's happening. On the other hand, is even if you do now the test to just calm yourself down, any day you can get it. Like maybe next day after you check that you don't have it, you're gonna get it. So what's the point? So I think let the people do the testing for the people who might be suspicious, or if someone is doing population-wide monitoring thing, yeah, or just do some breathing exercise if you're feeling that. Like panic thing is real. People do have these things, and psychology is very important bit, but there are different methods rather than molecular to calm you down.
So the panic. Advice on the panic. What do you do yourself? Do you actually read the news? Or did you stop reading the news? How do you think people should cope with that? Because I think we all can overthink quite a lot, and especially if the bad news are around us, and a lot of people are talking about it on social media. So how would you say people should cope with this dilemma?
In a way, I would just say ignore all the information. the necessary information, something that like changes in law or like in quarantine and so on, they're gonna get to you. Your friend's gonna talk about this, like maybe the main news of the day gonna cover that. Because the problem is that everyone is interested. Everyone, like it's important for everyone, but not everyone has the right background to interpret the results, but they're still writing about it, like posting about it and so on. Even for example, for me, so I'm a virologist. I understand how viruses work, but already like how virus interacts with cell, that's kind of a specific place in between immunology and virology. And I'm not really confident talking about that. And even vaccines, I know how the process goes. I know the main principle about it, but I don't know all that little specifics. And then I see people who know even less than I do on biology, someone from completely different background, which is quite normal for people to discuss things. But then they are going and commenting, they are doing initiatives and organizing stuff and making it like such a big deal out of, not necessarily about all this pandemic, but just sometimes people put it way out of proportion. To one side or another one. So, you have some people saying this is the end of the world, and then you have some people saying like there's nothing happening. So it's so hard to stay in that specific good place that I would just recommend. I think there is more misinformation online now than the true information. And especially, I think people are not good with coping with this point where you don't actually know what's happening. You know some stuff, but there's so much more interpretation information out there. That basically just don't treat it. The main idea, you know how to do physical distancing, what kind of the symptoms are, what can you do to prevent it. Stop reading. There's not going to be anything new out there. So maybe, news once or twice a day maximum, and that's it.
Yeah, and what about, we are young, so we are not scared that much, I guess. There's an age sort of factor in this epidemic. So how do you think older people should react, and how can we help in this situation as a young generation?
Everyone should do exactly the same thing, doesn't matter of your age. And I think even though we say yes, it is kind of correlated with older people, because age on its own is risk factor, and if that risk factor, it comes like other diseases. So basically, if you're completely healthy, fully healthy 60-year-old, you might be in a less risk than 20-year-old who sits the whole day in front of a computer, like eats trash and does not exercise at all. And maybe you have like asthma or something, which is quite common. But even some people don't know about that, which, for example, it was the case with one of my colleagues. She's like about 30 years old, and then she recently found out that she has asthma. So, like, even though we are young and we think we don't have any risk factor diseases, there might still be that we have those diseases, we just don't know about them. So I think for people who are definitely healthy and definitely okay to go out and help people, I think just, do that. Like, coming together is really cool. I think I really enjoyed seeing, I really enjoyed seeing, for example, that, have you seen it maybe? Our basketball player, Mantas Kalnietis, was also going and delivering food to some older people in Kaunas. And he was like, okay, we are not allowed to play basketball. What else I'm going to do? Like, I'm a healthy, sporty, young person. So I think that's a brilliant example. And, for example, in UK now, it's impossible to do home delivery of food. And then initially I was annoyed because like we are not used to going to grocery shopping. We do everything like once a week, big delivery. But then it was okay, like there are people who need it more than we do. So then we go to the shopping center and that's okay.
Yeah, and what do you think about the response of China? Like they had quite different one and they were the first to go for it. Do you think we can learn something, or we cannot really be so strict about putting people in prison or giving them fines for just doing something that, out of order?
But in Lithuania, people are getting fined. So it's not that different. But there are like countries in Africa, for example, who are very scared of another outbreak. Some countries just cleaned after like Ebola's outbreak. And they are actually really scared now about the situation. So I heard cases where someone was even shot on the street or something. So maybe that's a bit too harsh. But I think in China's case, that case was very unique, right? Initially, you don't know what's happening. Even the first patient, you don't know what is it. You don't immediately sequence all the viruses or all the genome of that person. So it really takes time to understand what's happening. So I think China's case was very difficult because you have brand new thing which might go so out of like hands, and you can't really do anything about it. And again, it's such a dense population-wise, like cities and so on, where it started, that it's really tricky situation to handle. And I know there are people who said like maybe they could have reported it sooner, they could have like told WHO about the problem sooner and so on. So maybe there are things to question, but I think it's definitely not the material to like sue the whole country for I don't know, zoonotic jump. So what's next? So next time, like maybe someone in Lithuania, I don't know, eats or dissects some swine or something and gets zoonotic jump, and then we will have maybe not the best politicians in our country, and the whole country, the whole people are gonna be fine. I think it just like adds unnecessary tension in the world. You can always think like maybe you have done something better or something, but it's also maybe blame on us to say like, what do we believe in? We kind of know how kind of communist regimes work and so on. So that you should take everything with a pinch of salt, and then it's better to be prepared than ignoring the situation. So I think China was in a difficult situation and it handled as it handled, and that's it.
Yeah, at least now we got to know that that there's a certain disease that was spreading, and by now we reacted. So what about the future? So what should we expect? How is it? Should we cancel 2020, or how is it gonna go? What do you think?
We can put 2020 on the internet virtually, but I think people in difficult times come very creative, right? as like in Vilnius, they did those open air cafes, you have drive-in concerts, you have drive-in cinema, and even, you know, if you go for a walk in a park and if you bump to someone you know and you keep the distance, you can have a chat. That's okay. You just don't spend too much time together in enclosed environment. So I think one thing is just to learn how to not just survive, but live in such times. Because we might have more of these. It might be that this virus just stays with us completely. Maybe, like, we are not guaranteed that vaccine will work. Maybe it will take 10 years to develop a proper one which works and works in every person. Again, we have people who are anti-vaccination. So maybe they will make this virus circulating around. So there's nothing definite. So maybe I would sign up for psychologist and start going regularly, maybe once a week at the beginning, and once every 2 weeks, and work with yourself how to deal in uncertain times and uncertainty that you cannot control everything in your life. And then another thing is actually like just hand hygiene. And people say like, yes, my mom, my dad told me how to wash my hands. Meanwhile, there was so many like studies or something where people looked even in healthcare workers who definitely know the meaning of it. And people are not washing their hands, even after toilet, or not properly, just like, you know, a few seconds and that's it. So just literally to learn and wash hands and the meaning of it, how important it is. Or like just washing your fruit and so on, even though there are like, I think no known cases that someone would have gotten corona from eating vegetables or any food. But that's just good hygiene practice. We don't need to live in sterile world, but we're already getting stuff we want it or not. And we sometimes forget to wash hands. Whatever, maybe there is no water around you before you're eating some fruit or something outside. It's still gonna happen, so you're gonna get your microbes. But just literally just washing hands, being aware of pathogens. We are here constantly surrounded with hundreds of bacteria and viruses around us. So I think it's maybe good just to be aware of that. Maybe not become germophobic. That's phobia in a way, right? But I think for future, one thing for us, just wash hands, be aware how to act in this situation, know how to deal in such situations psychologically. For countries and governments, it's super important to have plan, right? How to act, like, do you have reserve? What do you buy the like masks and all that kind of from in big quantities? And just to ensure that we know how to react. Because now it was the case that in some, especially smaller hospitals who never, for example, ever had some infectious patient, like there's something bad infectious, people didn't know how to react. And, you know, in this case, it was that, you know, even doctors are the same people as we are. They know their medicine stuff, but they don't know anything about the infection, how to act around viruses. Actually, scientists are way much more used to, like virologists, working in an environment with viruses than medics. So, you know, if you're going to do some procedure and your hands are shaking because you're afraid, that's bad. So I think, as like in UK, we have a lot of fire drills where we practice how do you act when there is a fire and so on. I think every other year at least, there should be like pandemic outbreaks to see how does your system work. For example, in my partner's company, about a week before lockdown in UK, they started doing like one part of the company, like that day you work from home, the next day another part, and the idea was to check if VPN is gonna stay all right, working, functioning. And then after every person has tried working from home for one day, next week they started strongly recommending working from home. So, you know, stuff like this, just be aware that this might happen. And it will happen in the future. Just the question is when, right? And I think that's quite commonly and widely distributed among people. Because we have like, I don't know, a few hundred viruses who can infect humans. And there are like another thousands in other mammals who potentially can jump to us. So you never know.
Yeah, so basically stay healthy, keep moving. And
also people are asking like how to strengthen your immunity. There is no such thing as like strengthen it, but you should just not destroy it. And the annoying part is that you should stay active and eat right. And no one wants to do that. That's the problem.
So as a scientist, I don't know if you thought about it, but we are currently collecting a lot of data and we have very interesting situation. So like in the history. So what do you think will be great questions to ask after it's finished?
Oh, there are so many questions you can answer when you have loads of data. I'm that person. So basically, we sometimes say that we do data mining and so on, but I think now there are so many initiatives to check many different chemical substances which will work against virus, and for that you need, I don't know, the same machine learning, magic words, and so on. I don't really think that anything needs to change actually dramatically, or what we should look for. People are looking into these things. Just need more funding, as like always. Because even if you have machine learning, you do data mining and so on, at the end of the day, if the drug is not checked how it works in human population or in animal models, even if you have that, so for example, the drugs, we have so many drugs which we know works against viral protein or DRP, which makes the copies of the virus. And they should work in vitro for this virus as well. But unless you know how the disease develops, at which stage to give it, to give the drug to a patient to see the good outcome and not to have any side effects, you're never going to know that from any data mining or something, because we don't have full perfect information in the data out there. It's not possible to have that. So in any way, there's going to be need of a lot of wet lab work where you do experiments. It's going to need, there's going to be a need of clinical trials and so on. So just basically do not ignore all the different areas of fundamental research, because now we are mostly focused on like cancer and so on and neurodegenerative diseases, but there are other diseases out there, and it might sometimes kill more people than that. Meanwhile, actually, the biggest killer of all in the whole world probably is cardiovascular diseases, which again comes to healthy lifestyle. And if all of us sitting every day in front of computers for such a long time, I heard someone saying that that's like a new smoking. It's like in 70s or something, people didn't know how bad the smoking was. So it's now something that they're sitting down. So just stretching, exercising, that's important. But research-wise, I think not much is going to change.
So did you change your PhD topic, or at least mention Corona now?
I think people will start mentioning it in papers just to get more reads and maybe citations. Personally, myself, I just think that it's better not to produce any science rather than produce something very shallow, not in depth, just to be on this bandwagon. But I might not survive and not get funding because I don't have that coronavirus paper. But for my PhD, I'm not going to write anything about coronaviruses. In a way, there's nothing new. Actually, from virological perspective, this virus is really boring. There are people who are looking into more in depth about this virus. So in our division, there has been submitted some projects to get funding. But that's like very in-depth knowledge of a virus. You don't need to have that much in-depth knowledge on every virus. And for me, it's more like to have at least some knowledge of something that already exists out there. So like that very, very beginning, where you have the genome, you know what kind of proteins are in there and so on. That then if we have next epidemic, someone can take that knowledge and then go in depth more quickly. So yeah, that's sadly not going to be any part of my dissertation. I spent so much time on this, but then because like you read bits and pieces, you advise some people on this and that. I did quite a lot of public outreach because you think like, okay, if it's not me, then someone else who does not understand the topic is going to be out there. And we saw a lot of people, for example, people saying that sun UV kills the virus. It's not the case. Like to kill the virus with UV, you really need a very strong UV light, which would kill all the humans in a way faster than it's going to kill a virus. Like it would, our skin would burn, like, and mutate and so on. And sun does, like, because we still have atmosphere and we have ozone layer, all of that filters that super dangerous UVC light out. So, and then you see quite official high position people talking such nonsense that, go outside and just like, be under sun, it's going to kill the virus. Or today I saw someone saying that wearing masks are killing people because otherwise we would just breathe in the air that UV and it would disinfect your lungs and so on. In a way, it's sad, but it's very expected. So yeah, I think this is why I kind of try to go out and talk to people or answer someone's questions so people don't start hurting themselves. And that cannot go into dissertation.
So I think with bacteria, sun kills bacteria, right? Like I think for example, for the skin, if you have bad skin and you go on the sun and it's clean, then it's good for your skin. So where does it come from? The UV light killing the viruses, bacteria, all these things.
I think because that very strong UV kills it, that then it gets like information density and informativeness dilutes as it goes through people's minds, and then at the end it ends up like UV kills bacteria and virus. You don't think about the spectrum of that UV. So I think being in a sun, it's like for vitamin D and so on, good for us. Then being in a good mood and that kind of stuff, I think affects our health way much more. What kind of hormones and so on we're expressing. But that's what helps. And yeah, there are many benefits of being outdoors, but it does not kill viruses or bacteria.
So what kills the viruses? Washing hands. What else can we do proactively to?
That's as simple as that. It kind of stops there. When you are maybe eating foods, if you eat raw food, that might be like for, I think, noroviruses. That's quite the case. It was somewhere on Twitter where, our own norovirus researcher ate some seafood and that got norovirus. And in a way, there are many viruses who make us sick, but are not mortal or like deadly to us. So again, just accept that that's going to happen. This is how we live. And yeah, don't eat raw foods and wash your hands. Not all viruses can be killed by soap. Like half of them cannot, but then just physically you're removing stuff from your hands. That also helps a lot.
For sure, we live in times that could have been a good, movie, and now we live in it. So, yeah. So,
I think in a way, as you mentioned, like the movies or something, that maybe people also want sometimes to dramatize it. That like actually now, if you would make a movie, it would be dead boring. People just staying home and doing random stuff, having fights with their family members maybe, and going for a walk on their own once a day. That's a boring movie. But then you need to go to like hospitals and show how everyone's dying and so on. I think apart from epicenters like New York and so on, everywhere else it was like actually quite normal. Like if you don't have this massive number of people dying in one place, all the other places were quite okay. And then you can go actually every day to your hospital and film people dying. That's happening every day. I think again that's something that we take for granted, that no one's dying just because we don't see it. while for medics, it's kind of, you get used to that as you progress as medic. And people are. And this is, why it said quit smoking and so on, because, you see how someone like, you get the anesthesiology, you have operation done, and sometimes you do not wake up just because you were smoking, and it was so massively disrupted the whole recovery process that you just do not wake up. And people don't want to hear that. So the problem is just, I think that we are not aware how dangerous the life is in general, about how prevalent and around us are all other diseases, from heart attacks to coronavirus deaths. That people think that, okay, no one was dying before, and now we have these numbers dying. So just be aware what's happening in this world.
And remember that we're privileged to actually live as well, even during these times. Something to tell our grandchildren, and we don't need to go to the war or do anything spectacularly, challenging or...
Exactly. And yes, it is hard, but and I understand like psychological problems and so on, but I think in a way, maybe psychological problems, they also arise because you have so much time to think how you're feeling right now. And people are usually not very much into analyzing how you feel. And now you have those interactions with people. And I think it's probably extremely hard for someone who's like very extroverted person, very social, and now is stuck at home alone. So there is like hard moments, but these are kind of luxurious hard moments. It's not that we are lacking food. We are constant in like danger of death, even though in a way we are, like my friend's family said that when they are walking now, because you need to keep the distance if you bypass someone else, they're walking really around and then sometimes stepping on the road, just like there's still a chance to be hit by a car every day. Just, be aware that these things are there. Yeah. So in a way, we just need to, like, that's not a very hard price for majority of us. There are people who are really struggling, and people who lost their jobs, and like social, like sensitive groups with, many kids, not that much money. And these need to be solved. And I think this is where a lot of focus should go and help. But for a lot of us, and probably for a lot of people who are going to listen to the podcast and so on, yes, it is not super easy, but it's not really hard. It could be way worse. And I think in a way, a good thing, it's going to pass, but in any time it might come back. So, just be aware that this is how life it goes. It's not everything under your control, and it's not something that's all joyly rainbows and unicorns. And you sometimes need to stay home.
Somebody told me that it's a quarantine is like a pension. So now we all can see what kind of pensioners we will be.
Yeah.
So
in a way, that's actually a good point. And I think in a way, now you can see that when people feel lonely and so on at home, think about all like retired people, alone people who do not have families and so on. So I just hope that maybe more people will start volunteering, just going and talking to someone. And I think in London, when I was studying there, that there was suggestions where lonely people who are living in their own flats, like in central London, they have like spare space at their flat, but they don't have friends, like because everyone's dead or something. So then they let students live there for free. So they have company, and students don't have money, but they need someone there. And then they become friends just because of living together. And I think a lot of old people are really cool people who actually have stories to tell, way much more suffering than we are having now, like some adventurous life. So maybe that will bring out some empathy for people like us, like not us, like us now in this moment. But and I heard like a lot of stories how people, finally calling back to some family members or like long no see friends and so on. So maybe in a weird way, very maybe not sensitive way to say, but maybe it's going to bring a lot of good stuff as well. Like look at the nature. Finally, animals have some space to breathe.
Exactly. For myself, it brought me so much like focus and so much like space, and then I feel okay. I can really be here and now. Maybe it's good, and especially if you put that energy somewhere. So we have a lot of books, so I managed to read a lot. I even tried to paint, very bad painting. But just having that and understanding that we're all gonna be like crybabies because basically you have your freedom taken from you, and just working with that, and then let's see how we're gonna raise after the quarantine.
And actually, for me, like initially, it was like one kind of situation where I could ask like a psychologist questions. And then for me, initially, it was like, I feel kind of bad that I feel so good during this moment. And I think everyone who knows me, no one will say that I'm an introverted person. But I really feel good. And I think that I had a lot of this fear of missing out, this whole FOMO. Because like I think in Cambridge, there is so much stuff happening all the time. You have good talks, then you have society events, you want to keep those people in touch, you want to, go to some talk with your colleagues, and you want to go to visit your friends and so on, and there's so much stuff happening, and then you have your own hobbies and stuff to do that is just like, how can I cope with that? And now I have only all the time for myself. If I want to have like friends Zoom call. I finally come back to running. So I was running all the time, but then just like this is something for my own pleasure. So I should prioritize something else. But now I'm on routine, doing stuff as I probably always wanted to do. So in a way, I didn't want to rub, into someone's face how happy I am now. But on the other hand, you just want to share that this is possible. Like, just use it for your own benefit. And in a way, maybe sometimes it is quite cruel to say, but I think working with yourself and like psychologically is super important. And maybe even though if you now feel really bad psychologically, if you are like fired from job and so on, these are serious reasons, these are outside factors. But if you just can't cope yourself, maybe it's in a way you are now in a place where there is no other way, just work on the problems. And especially if you live alone, then like those psychology sessions through Zoom and so on, they still can work. Maybe they are not as good as possible, but I think I'm just like, I'm a big ambassador of people taking care of their mental hygiene. So I think that's the time to do that.
For sure, it's a good time to become friend with yourself, and not all the friends are the best friends. It takes time, and sometimes you just need to let it speak, and the friend would get used to it. But it's good. I think if we manage to focus and say, okay, I want to get something out of this, I can, because now I have more time. So that time can be used to grow something, and
And as they say, I think like learn to control the controllables and let go something that you cannot control. So what you can do in this quarantine is like washing your hands, staying healthy, sleeping is important, helping maybe other people as much as you can, or not helping anyone, just focusing on your work. Maybe now it's perfect time to finish that paper that you've been working on, or write a book, or whatever you've been working on. Just focus on you can change. There's a lot of stuff that you can control, but if you can't change that, okay, like I don't want to at this time that there would be pandemic in this world. It's not going to happen unless you maybe think like, okay, maybe I see how I can help to slow it down, to get rid of it. Then go with your ideas to government and so on.
If you needed a sign, it's a sign.
Now is the time.
Okay, so as I always ask this question, the last question, every person who comes on our podcast. So as we are Lithuanian Dream Podcast, I was wondering, what is your personal dream for Lithuania for the next decades?
decade is actually not that much of a time. So actually talked to my sister, and she shared with me some interesting statistic that, for example, do you want to guess how many people who go to prison come back to the prison after they are released? What percentage?
I think it's 80, right? There's that 80-20 rule, 20% of criminals. I don't know.
So all the people who go to prison get released. Like the percentage of those who come back to the prison is 60%. So, they're also, so someone was writing a plan that their goal is like, I think in next 10 years or even 20 years to have 10% less. So I think that's like reasonable goal. So coming to something like realistic, I really wish everyone takes care of their mental health. I think, to be honest, I think we have probably way many more cases of severe bad psychological health in Lithuania than we have with coronavirus. Just taking into account all the suicides and, all the violence in like household and so on. So I see that people are going there. We have like influencers talking more openly how they're going to psychologist sessions and so on. So I think in a way I would like to see Lithuania a bit more open, a bit less conservative, in the sense that, we are used to be all by, one shape, one size, one look, that's great. That we are a bit more open. We allow other people to be the way they are, which comes from internal psychological strength, in my opinion, yeah. And if the same thing for like science, I would just really like to see more funding. And with that more funding, that there would come a bit more international people to Lithuania, because I feel we really lack diversity. And I think that's one thing, because like I do plan to come back to work in Lithuania at some point, but just thinking that all the people are kind of, from the same cultural background, it's so interesting now. I think after being here, especially in Cambridge, we have so many different countries. Our lunch talks are, 60% of the time about, so you do that in your country, or like, so, okay, in your culture, this is like what's normal. And it's so interesting, so nice to understand. And I think this is, maybe if I would be living now in Lithuania, I would react to China's case a bit differently. I'm not pro the government, but you should understand, if you are, fining or like saying this is a Chinese virus and so on, you are being racist to many, many people who are there. And maybe some of them are completely fine with their government and they like that. Just learning to accept that there are different people. So I think that's something that I would really wish Lithuania to have in 10 years' time. Not necessarily more diversity, but be more open to the idea of diversity. And washing their hands properly.
For sure. It's so important. I'm currently reading a book by Valdas Adamkus. Yeah. And he is actually a huge advocate for that. And he's writing how like sometimes you can deliver a bad message, but in a nice way. Yeah. And then person is even less angry on you than if getting the positive, but not in a nice way, like sort of. So there are good examples in our country already, and people putting the seed. And I guess we're just need to work and garden and try to grow it. That seed. Thank you so much.
I'll keep planting that and taking care of that nice plant. Thank you.
Thank you. Yes, for sure. Okay. Ačiū labai. Thanks to everyone who helped us with our podcast recording, to Vytautė Rimkutė, who takes care of the interviews, as well as to Sean Donovan, who is our editor-in-chief, and our designer, Milda Sukyte. Don't forget to follow us on Facebook, LinkedIn, Twitter, and Instagram, as well as check out our new website with incredibly well done designs, and subscribe to our newsletter, which will deliver new episodes straight to your inbox. So thank you. It was Ruta Naujokaite, and talk to you next week.